Now warning Biden's vaccine mandate for healthcare workers could worsen patient care and healthcare labor shortages.
That's right. Now let's get to the two members from the caucus. Joining us now, Tennessee Congresswoman Diana Harshbarger and Iowa Congresswoman Mariannette Miller-Meeks. Thank you both for joining us. Appreciate your time. Congresswoman Harshbarger, I'll start with you. This is something that could potentially impact every single American out there. If your hospital or doctor's office or medical care facility has labor shortages, what does that look like?
Well, absolutely. We have a healthcare shortage now, and if this mandate goes into effect, they've not seen anything yet. You saw what happened in New York when they fired the nurses and physicians and they had to bring the National Guard in. It's going to be bad because labor shortages are absolutely contributing to supply chain issues and a disruption in those issues. So we'll see what happens, but this is, they haven't seen anything yet.
Congresswoman Miller-Meeks, what I can't get past is this notion, and bear with me here while it's a little wordy. If I'm having a heart attack and I need help and time is of the essence, I don't care the race, gender, sexuality, and definitely not the vaccine status of the person that's coming to save my life. Why has it gotten to this point?
Well, certainly all healthcare facilities want to keep their patients safe. But the problem is you can't keep people safe if you don't have workers there. So as Representative Harshbarger just said, there was a hospital in New York who fired members. There was also a hospital in New York that closed down its maternity ward because it didn't have enough staff. And we're not even talking about immunity. We're talking about vaccines. So there are people in the medical profession who have had COVID-19. They've recovered from COVID-19. They know they have immunity. And so we should be talking about immunity, not just vaccines. That doesn't mean that we want people to go out and have COVID-19 parties and get infected. Sure. That's not at all what I'm saying. I am saying that there is immunity from vaccines. There's immunity from having an infection-acquired disease. And I put forward a bill to mandate insurance coverage for antibody testing, both serology humoral antibodies and T-cell antibodies, which are the long-term antibodies. But we are going to create more problems in our healthcare system, and that's going to cost lives just as well as any of the the process they're putting forward, mandating the vaccines, and it will increase vaccine hesitancy.
And real quick, before we move on to the next topic, Congresswoman Harshbarger, do you feel like this warning that the two of you are offering is being heard by the administration?
Well, not at the moment. We're still waiting on the text of the rule for OSHA to enforce this mandate. All we're asking is, will you look at natural immunity as like you do the vaccine? If you've taken the vaccine, we know that these people who have had COVID once or twice, as my friend Mariannette was speaking about, we can do antibody testing, and there's plenty of peer-reviewed studies that show that natural immunity is just as effective, if not more effective, than taking the vaccine. Why not look at that, or let us do once-a-week testing for these people, because it's going to cause problems, and I don't think they understand at all how bad it's going to be.
Congresswoman Miller-Meeks, we're running up against the end of our show, so I need a quick answer to this question. Jen Psaki and Nancy Pelosi literally begging their Democratic colleagues to embrace Joe Biden's social spending agenda ahead of the International Climate Summit. Don't have time to play the soundbite, but my question to you is if it's such a great plan, why do they need to beg their own party to get on board? 30 seconds to you.
They don't need to beg their own party, pass an infrastructure bill. They would have bipartisan support for that. Forget the other bill because they're having difficulty even among their own party to get it through.
And that's the situation we're in. Quickly, we have a little bit more time. Are you worried about Biden giving away the farm there at that climate summit? Now 10 seconds to you.
Yes, I'm worried about giving away the farm.
There you go. Wow.
Wow.
Efficient. Do not mess with a doctor named Congresswoman Mariannette Miller-Meeks. And also, don't mess with Congresswoman Diana Harshbarger. Don't mess with either of them.
Thank you very much, ladies, for joining us. Appreciate your time. Have a good day.